The increasingly significant roles of pharmaceutical procurement teams. Reframing the cost versus value discussion. Best practices for vendor management. How can pharmaceutical brand teams work more collaboratively with their peers in procurement to meet shared goals? And what value metrics do brand teams need to consider when discussing selected vendors with procurement? Join us to find out. In the Know starts now. Hello and welcome to In the Know, your source for insight and analysis on the issues that matter to our dynamic healthcare market. I'm your host, Gina Clark. Today we discuss best practices that manufacturers can use to increase the productivity of their vendor selection processes. Procurement teams have historically served as manufacturers' gatekeepers to drive down vendor cost, but their mindset has, at times, clashed with their counterparts on brand management teams. We'll explore how this internal rancor can be avoided while still keeping cost in check and achieving desired value. Here to offer her thoughts on this topic is Kristine Flemister, Vice President of Operational Excellence for Xcenda. Kristine, thanks for joining us.
Thanks for having me.
Xcenda has worked with companies in the pharmaceutical space for more than 20 years. How has the role of pharmaceutical companies' procurement departments changed during that time?
To be honest, since the early 90s and in the early 90s, business partners were able to make their decisions directly regarding the vendors in which they wanted to work with. And in fact, many of our pharmaceutical industry clients did not even have procurement departments. Over the last 2 decades, we've seen the role of procurement expand significantly. We've seen the stricter regulatory environment, downward pressure on drug prices, as well as increased shareholder expectations. And this has led to our clients more prudently looking to manage their expenses, specifically as it relates to research, sales, and marketing. So one of the ways that our clients have embraced and managed this evolution is that they put appropriate processes in place to be able to evaluate a vendor and ensure that they're getting the best price for their purchasing dollar. So we at Xcenda not only respect this movement, but we embrace it and have developed a procurement-focused strategy in which we view procurement professionals as true business partners and not as potential adversaries, which is often the case in some situations. We have seen positive results from this approach in where by providing routine updates to our procurement colleagues regarding the breadth of our services, new people, things of that nature, that we have seen more often we're being asked to be involved in preferred vendor processes as well as RFPs. We've also been brought in by our procurement colleagues to a brand new team that we have not worked with in the past, where they believe that Xcenda can fulfill a critical business need for their business partner.
Based on your experience, what are procurement teams focused on today? And how does that weigh into how brand teams work with their vendors?
Well, setting price aside, we have seen that procurement teams are definitely focused on evaluating a vendor's compliance program. Specifically, they want to be sure that a vendor is well prepared for them in managing risk. So the procurement teams are looking at standard processes. They're looking at the compliance training programs that a vendor has, as well as their overall understanding of industry requirements. And by doing that, they're able to better assess the level of risk in some of the decisions that they're making as it relates to vendor selection and recommendation.
The regulatory environment seems to change, it seems, by the minute, but pharmaceutical companies have to remain compliant every step of the way. What can procurement teams look for as they evaluate a service provider to ensure it has adequate knowledge and processes to manage compliance issues?
So the procurement team should be looking for a consulting group or a vendor that is really compliance driven and has quality at top of mind, that they have routine training programs for their associates and provide access to best-in-class technology. So again, a very compliance-driven organization. At Xcenda, we have associates and teams who focus primarily on compliance training as well as compliance reporting. So we proactively reach out to our customers to make sure that we're up to speed on what their requirements are, what training programs they have, and then we implement systems and processes to ensure that we make sure that our associates are fulfilling those needs and that we can report it in a timely manner. So whether it's credentialing our field reimbursement specialists or our interactions with healthcare professionals as it relates to our payments to them, contracting with them, understanding fair market value issues, Xcenda utilizes the state-of-the-art compliance training and tracking tools to ensure that we have information readily available for our customers. So by having all this compliance focus, we're able basically to ensure compliance and minimize risk for our customers. The other thing we also do, this compliance team that I talked about, we proactively reach out to our customers on a periodic basis for any type of recently implemented or pending legislation. For example, with the pending Sunshine Act that relates to industry having to record and report their payments to physicians and teaching hospitals. This is a pending legislation that we have been working with our clients on in terms of specifically what systems are they going to use to track and record all the payments that they're making to physicians and teaching hospitals, and additionally, what are they going to require of us as a supplier in terms of what type of information, what systems will we be using, as well as the time frame. Are we going to be submitting information after each project or on a quarterly basis? So again, our goal is to be compliance driven and really be ahead of the game so that we're prepared once the act is in place for our clients.
In what ways are procurement teams definitely getting it right with their evaluation methods? And in what areas would you like to see them reframe their mindset a bit?
Well, I think the procurement teams that are focused on a true partnership, that's definitely the right approach. A partnership offers pharmaceutical manufacturer a greater sense of security. So they're not concerned that a vendor is just focused on getting a deliverable out the door, but that they truly have the pharmaceutical manufacturer's goals and interests in mind. One area that does cause some challenge is a tendency, though, for procurement to place a really high emphasis on an hourly rate. And while the hourly rate we recognize is a very important factor in evaluating a vendor, we encourage procurement teams to look at all factors that a consulting firm contributes to deliver the highest quality deliverable at a competitive price and really serving as a true partner in that regard. So while it's not immediately apparent when you look necessarily at an hourly rate for a given associate, one of the things that you might find is that we place our most experienced and qualified professionals on a project. So they may end up having a higher hourly rate, but yet they can achieve the work in less hours, and the net is actual lower costs on projects. So, you know, by partnering with Xcenda, that provides the benefit of access to over 230 fully staffed, full-time experts. So we are able to provide our clients efficiencies because we have such a broad yet strategically aligned set of services as well as skill sets. So, you know, lastly, our staffing model is really client-focused. So our associates are privy to and gain an understanding of our clients' products, their therapeutic interests, as well as their goals and objectives. So they are more efficient in working with the client, and they're able to apply that knowledge on project after project after project.
Consulting services are not a commodity or a product where a comparison of features and benefits can be easily calculated. What challenges does this present for procurement teams who are tasked with finding the best service providers to support their internal customers?
So as a consulting firm, knowledge is our product. And since knowledge is not a commodity, it can never be purely evaluated based solely on price. Yet, our procurement colleagues have to put a price on our consultants' expertise, their insights, the ability to tap into over 2 decades of experience in understanding payer and provider decisions. After 20 years in the industry, I've seen one thing remain consistent. More knowledgeable consultants are producing strategic recommendations and tactical deliverables that allow pharmaceutical manufacturers to maximize the impact of their purchasing power. So the challenge is for pharmaceutical manufacturers to really reach out to their internal business customers and listen and hear how their business partners are placing a value on a consultant's knowledge. So again, they're not just looking at a particular hourly rate or a price, but they're valuing the knowledge that a consultant brings. The other challenge or thing that a procurement group can do is look for a vendor that has a proven track record. At Xcenda, we have a number of associates who have previous pharmaceutical experience. So folks who have been brand managers, on reimbursement teams, training, as well as leading health economic and outcomes research departments. So we uniquely understand and have a keen understanding of what the internal business partners' roles and responsibilities are from a day-to-day perspective. Additionally, we have a number of associates who have served in formulary management or healthcare decision-making roles within managed care organizations or integrated healthcare systems, as well as provider groups. So in essence, a number of our associates have been our customer's customer. So we understand what payers and providers are looking for as it relates to evaluating therapies. We also, as far as what a procurement team can look at, is really bench strength, I'll call it. And we've assembled a team of clinicians, technical researchers, payer and reimbursement strategists, as well as health policy experts. They all have a significant publication and conference speaking presence. And moreover, they actually are actively involved in a number of professional societies, either in leadership roles or serving on committees, such as the Academy of Managed Care Pharmacy, as well as the International Society for Pharmacoeconomics and Health Outcomes Research. So by active participation in these associations, we feel like we're able to help guide the future of our industry, or at least have a say in it. And what that means for our customers is that we can bring them timely access to new information that might be coming from these groups or guidelines. We often find that we can bring that to our clients prior to them even having knowledge that there might be such a change.
What can internal staff at pharmaceutical manufacturers do to broker more collaborative, knowledge-based decisions among their own procurement teams?
Well, first, I think that the vendors and the internal manufacturer teams need to work closely and clearly understand what the procurement department's goals and objectives are, and dig a little bit deeper and find out specifically what challenges that procurement team may have faced as it relates to vendor evaluation and selection. And then secondly, we want to be sure that the vendor and the internal teams are ensuring that the procurement teams are completely up to speed on the breadth of services for a vendor, so providing opportunities for a vendor to come in and speak to the procurement teams about new services, new people, how we manage and approach our compliance and quality programs, so that they really can see and understand the value of the relationship that they're getting.
In your discussions with pharmaceutical companies, do you see continued evolution of how procurement teams approach vendors like Xcenda? And assuming so, how do you feel this evolution might be accelerated?
I think at the end of the day, it's all about establishing credible, collaborative, and transparent partnerships with all the stakeholders. So I do believe that vendors and the multidisciplinary teams who are developing and or commercializing the new products, as well as the very important procurement function, that they're going to be working more closely than ever in the years to come.
Kristine, terrific insight. Thanks so much for the time today.
Thank you.
And thank you for joining us. We'll be back soon with another all-new episode. Until then, if it's on your mind, it's In the Know.